Hello, my wonderful community health and wellbeing workers. Here we are, we're at duty one, and we're going to look at our first set of skills. So I'm really excited about this because I'm a mental health nurse. This is my background. This is what I love doing. So I'm going to try and give you as many tips and as hints as we can to get through this skill set. Pause the videos, go in, reflect. What I've done is I've started to create you a toolkit. So I've done some toolkits for you to have a look at, and I'll explain this in a second. I just want to explain some of the basic principles as well as we go through. So let's dive straight in and have a look at where we're at. So we're going to be looking at here, duty one, skills. We're going to recognise and help others to recognise the factors that impact health and well-being. We're going to help people, groups and communities to identify barriers. We're going to assist individuals, groups to recognise needs, and we're going to work with people to communicate, to identify across local resources to assist and support their health and well-being. We'll then look at the assignment, which is there, and then we will look at the example essay, and then you've got your example essay at the bottom. So just to go back a stage, because last week we covered the knowledge, we went through that knowledge, and we had a look at that, and we looked at recommended reading, we went through the PowerPoint presentation, and we looked at the end exam. We're now going to look at the practical. And what I started to do last week was build your toolkits. So part of your role as a health and well-being practitioner is to give health promotion advice. And what I have done for you is I have put together a health promotion initiatives in the UK. So we've got the Hub of Hope, which is the first UK national database for mental health services. Everyone Matters, Mood Zones, Mind and Rethink, which are the leading charities in mental health. Be Mindful, which creates a mindfulness course. Live Life to the Full, Silver Cloud, All Mental Health, CBT, Mental Health. Then we've got Smoke Free, that's your smoking sensations, that's your physical health. Your 0 to 5K coach, so that's physical movement, physical health. Your food scanner, that's about your physical health, so cholesterol, weight. Drink-free days for substance, alcohol. Yourself, CBT stuff, so that's, again, mental health. Fitness studio, about movement. NHS on the go, to do with all your other physical health complaints, common conditions. Sleep station for sleep hygiene. Eating and nutrition, it is what it says on the tin. Physical activities, again, it is what it is on the tin. Alcohol awareness, sexual health, cancer prevention, children's health, and health education. So you can see there is a whole array of resources there for health promotions. You don't need to learn them all. You just need to know what they are to signpost. The next thing is we talked about social prescribing. Social prescribing is when you are listening to a problem and it is not a health or mental health problem in its primary root cause. So that's not to say that people with respiratory diseases haven't got respiratory diseases because of the damp accommodation. Yes, they've got respiratory disease due to the damp accommodation, but the primary cause is the damp accommodation. And if we can fix the damp accommodation, we can reduce that primary cause. So social prescribing is about active listening and drilling down to the point where we can find a solution. So it's problem solving. So social prescribing looks at these particular areas. And again, we'll add to them as time goes along. But social prescribing for substance misuse. So if you've got somebody that's alcohol, drugs related, there's some tips and hints there on how they can manage that. People around education. So if education is a barrier, so upskilling, getting back into learning, employment, trying to get into jobs, housing, trying to find affordable housing, gambling problems, pain management, money problems, weight problems, and neurodivergence such as autism, ADHD, and dyslexia. So again, there are organisations out there that are social prescribing organisations in every county. So every county has its IAP service, access to psychological interventions, and they also have the social prescribing side. Most GPs now have care coordinators, and care coordinators are normally linked into social prescribing. And the aim here is that we stop medicalising social problems. But equally, we don't want to burden the social system that's already burdened. So trying to give people the tools to manage their social problems to get out of the problems that they are in. Equally, we've got then strategies. So it may be that you've got somebody that you're speaking to, and maybe they've got poor coping skills, poor resilience skills, or they've just got common mental health problems or common physical health problems. So these strategies here will help you think about, how can I care plan for this person? What is it that I can do to help them? So again, resilience, coping, critical thinking, and problem solving is 95% of the barrier. If you've got somebody in front of you and they're overweight, their cholesterol is up, they can't get a job, they're depressed, there's a lot going on. But the problem solving skills and the critical thinking skills will allow them to arrive at a place where they go, right, if I got out more and exercised more, then maybe I could lose a bit of weight. Exercise will improve my mental health and physical well-being. Fine, tick. I can't lose weight because I can't access good quality food. Fine. I need a referral to diet and nutrition. Fine. I need a referral to get food, whatever it is. It'll just help you plan. And then through that planning process, you may end up with social prescribing initiatives or health promotion initiatives. But ultimately, we need to move health and well-being back to the ownership of the individual to manage, rather than it being this concept, it's my doctor's fault I'm fat, it's my doctor's fault I've got depression, it's my doctor's fault I've got this. Because it's not your doctor's fault, unfortunately. It's not necessarily anyone's fault. It is a set of circumstances that has led somebody into that way. And our role is to simply be non-judgmental, actively listen to the problem, avoid worsening the situation, and then provide some solutions. So, for example, if you are listening to somebody who has an eating disorder, the worst thing that you can start doing is harping on at them about weight, exercise, and eating. What's important is that they get the therapy and the support to understand why they have that disorder, to look at strategies to manage their feelings around that disorder, and maybe some social prescribing, looking at groups and activities to help them. And that's all of the stuff that you can do. If you judge them, if you give the advice around you need to do X, Y, Z, then ultimately where you're going to be there is with people becoming much worse. I heard a story the other day, somebody who had an eating disorder, they were being forced to be weighed, and then they got weighed, and then they said, oh, your weight's gone up a bit. Well, that then forced them to purge and then go on this whole 2 weeks of not eating to get back under their goal weight. So it's that kind of mindfulness that we need when we're talking to people with complex health or mental health conditions to avoid those problems. So let's start and let's have a look. So we're looking at, let's go back. We're looking at skills one. We're looking at preventative approaches to promote the health and well-being of individuals. So going straight back to those toolkits: health promotion, social prescribing strategies to address individuals, groups, communities, and address the wider determinants of health of ill course. S1, we're going to recognise the help. S2, we're going to assist individuals. S3, we're going to help groups. And S4, we're going to work with people and their communities. So let's just look at S1, recognizing and help others to also recognize factors that impact on person's health and well-being, so they can or cannot control or influence. So let's break this down. Factors that can be controlled or influenced. So things that we're looking at that we can actually work with. It may be difficult, but we can work with them. And that's going to be things around diet. So choosing a healthy and balanced diet can have a profound effect on people's overall health. So think about those referrals, look at those social prescribing things. For example, down here in East Sussex, we have Active Hastings, where we can refer people to get sport and fitness. Exercise, regular activities, is known to improve mental health and physical well-being. So again, look at your 0 to 5K, look at your health promotions, look at all of that stuff there that can manage that. Sleep, we know good quality sleep has a significant impact on physical health and mental health. So sleep hygiene is where you need to be. Lots of good quality advice about, look, I know you've heard this before, but don't eat late at night. Don't drink drinks with caffeine and high energy stuff. Don't drink alcohol before going to bed. Try a wind down session, do a bath, practice all of this really good sleep hygiene stuff. And then, you know, don't use stimuli to get your brain from day mode to night mode. So just do a little bit of research on sleep hygiene. So when you talk to somebody, you're able to understand where they're coming from, but be able to give good quality information and advice. And let's not forget, we can do a referral. We could suggest that they go to Holland and Barrett or you know, the pharmacies. And Holland and Barrett, for example, do a free well-being consultation with their prescribers, with their well-being practitioners. And so, for example, around sleep, they can be given advice around sleep aids that are natural remedy and over-the-counter material rather than prescription. So there's lots of things that can be done to monitor sleep other than just going to a doctor and going, I can't sleep, I need a sleeping tablet. Because all we're doing is promoting reliance on medication. So we're not breaking habits, we're not teaching you how to manage situations, we're not teaching you life skills, we're just giving you a tablet and a reliance on medication and the NHS to move forward. We need to break that cycle. Stress management. So again, lots of things around managing stress. That's something that we can control and influence. I particularly love it when I used to be in general practice and people would say to me, Steve, I'm angry. I'd look at them and go, really? Well, anger is a normal emotion, you know. Were you being angry at the right time or were you 0 to 100? And normally when we dug down, it was simple reasons why they were angry. They were angry because they've got debt. They were angry because they couldn't pay their bills. They were angry because they couldn't put food on the table. They were angry because they weren't progressing at work. All social issues, all issues that could be managed with good social prescribing to reduce that. And what they actually needed over medication was skills, coping skills, resilience skills, emotional intelligence, cognitive behavior therapy to understand why they felt the way that they felt. Lots of stuff other than taking a beta blocker to keep them calm. Because again, there's limited evidence to say they work. And what most people used to say is, oh, I'm really angry. Can I have a benzo? Can I have diazepam? No, you can't anymore, because the NICE guidelines state that actually we're causing a further problem there. By giving you a drug that makes you docile, we're causing addiction problems down the long term. And people have been hooked on diazepam for lifelong times. That's not the way to manage stress. Stress is a normal part of everyday life. You need to learn to control it and manage it and recognize your boundaries. There's a great TED Talk, which I will add into this. I'm going to make a note. I will add into this. There's a great TED Talk about stress, and I want you to watch it. It was a profound talk that afterwards I went, oh my God, that just made so much sense. So I'm going to add that in. Her name was Gillian McKeith or McCartney. I can't remember. But anyway, her speech on stress was phenomenal. Phenomenal. So have a watch that. Alcohol and substance use. So again, of course, we can control it. But the problem behind that is there are root causes to substance misuse. Are we self-medicating because of trauma? Bet we are. Are we self-medicating? Are we drinking excessive or taking substances because we've got a neurodivergent? So we're looking for high dopamine rewards. If we can recognize a neurodivergent and get the help, we have an opportunity to reduce the risk of this person ending up in prison, reduce the risk of this 0 to 100, reduce the risk of this person relying on heavier dopamine reward products. So looking at substance misuse, getting early assessment is key for this. But equally, understanding people's trauma without being judgmental. It's so easy for somebody to say, oh, look, they deserve that. They're an alcoholic. They deserve that. They're taking drugs. What happened to the empathy and the sympathy behind this? Nobody chooses to become addicted to substances. It's something that happens over a period of time and it becomes a coping skill. Granted, a poor coping skill, but a coping skill nevertheless. So it's fundamentally important that we are able to be sympathetic and non-judgmental. Now, I say this because I've worked with a lot of people with substance and alcohol misuse over the years. And the one thing that will push somebody to drink further and take more substance is guilt. If you make somebody feel guilty, you are going to push them to their dopamine reward system much quicker and further. By all means, raise awareness. By all means, explain risk. But don't be judgmental. And I think that's the key thing. And we miss the compassionate bit as into why somebody is there. So when we work around alcohol and substance misuse, bear in mind that there is a root cause that we need to get to find out why. And if we can get to that root cause, we can then make the right recommendations for social prescribing, we can make the right recommendations for therapy, and the right recommendations for support. Every single town has charities that manage substance and drugs. So again, down in the southeast, we have a charity called Grow, Live, Change, and we have a charity called Star, and they manage substances. There's a female charity called Oasis, so there are male and female charities. The problem is when I've spoken to people that are using or accessing these services, they come back to primary healthcare because they feel judged. So we need to break this stigma. We need to try and show that empathy, that we're not judging, that actually it takes a lot of courage to go forward and ask for help. Medical care. So, of course, this can be controlled. So managing our vaccinations, our flu, the COVID, shingles. So whatever the government initiative is coming out based on the evidence and the research at the time, it's our role to promote health and education information. It's not our role to give an opinion on whether we think somebody should or should not take it. We are impartial practitioners. So if somebody said to me, Stephen, what's your opinion on the COVID injection? I've taken it, but I don't have an opinion on it. You know, if you ask me professionally, the evidence suggests this. That's it. That's what you're going to get from me, because I'm not going to have it said that my mental health practitioners, advise me against this. We're not there for that. We are there to give good health promotion. Okay. Hygiene, it sounds an obvious one, but it can be controlled. The amount of times that I've heard people go, but I can't afford this or I can't do that. And this is going to sound really odd. And I'm going to be very careful how I say this, because there's been a lot of backlash online over this comment. But in Asda, their basic range, you can buy a toothbrush and a bar of soap for under £1. I know that's controversial. But basic hygiene doesn't really cost a great deal. And actually, the benefit of just brushing your teeth and washing your hands and face and body parts has to be a priority, because it reduces the infection and all of the other stuff. So good personal hygiene is fundamental. And sometimes we just need to reinforce that benefit by maintaining good oral health care. We're going to keep our teeth and we're not going to end up needing dentists. By having a wash and keeping our skin clean, we're going to avoid fungal infections and sores and all of the nasty stuff. Social connections. So social interaction is something that can be controlled. Again, I am fully aware that social deprivation, social isolation is on the rise, but we do have charities and organisations out there that will provide support. So things like Age Concern, the Red Cross and Johnson. Now, I know all those charities are stretched as well. So it is the case of networking to see what's in your area. But even churches or community groups, you know, when I worked in London a few years ago, one of the things that I did quite frequently was take people to their churches, because it gave them that social interaction. And when you saw somebody in an environment that felt familiar to them, they flourish, they just grow, and their confidence comes back, and you can just see this. Equally, occupational hobbies. So if somebody is socially deprived, if somebody isn't achieving anything, then get a hobby, get them to interact with something. And again, I know what you're going to say, but Stephen, hobbies and things take money. Granted, some do, but some don't. So go online, have a look at those hobbies and interests that don't cost, and see if you can find something. And again, educational pursuit. Now, the best way to push somebody or to make them feel that they're achieving or to help break some cycles is through education. And there are many, many companies out there now that offer free training. Many, you know, forget colleges and funding for your functional skills in English and your apprenticeships, all that stuff, because I know there's barriers there. But there's online companies like Allison, which offer free diplomas where you can do the learning, upskill yourself, and help progress. So they're factors that can be controlled. And we need to understand that, because if we can't control it, we need to influence. We need to gently suggest and nudge, and auto-suggestion is a great way. Positive self-talk. Oh, I can exercise. I can improve my sleep quality. I can reduce my stress levels. It's all about giving them the tools in which we've talked about above, or in the toolbox, rather than saying, let's go to a GP, take medication. So let's look at long-term sustainable healthcare. Magic. So then move on to factors that can't be controlled or influenced. So things we can't control are genetic factors, so genetic markers, certain diseases, conditions. Obviously, we can't control that. But what we need to understand are the limitations of each of those genetic factors. So if we have a genetic factor, what is it? What's the traits? How does that genetic factor affect your physical health and your mental health? Because if we understand how the certain diseases affect those phenotypes, affect the body, then we can look at better interventions and strategies to manage it. There is nothing worse than saying to somebody with, I don't know, ME or fibromyalgia, what you need to do is more exercise, because they're going to punch you. It'll be a slow, painful punch, but they're going to punch you. Because it's just a ridiculous thing to suggest to somebody without understanding their limitations. So don't go offer stupid advice to somebody. All you need to do is this, and simplify it, because it will come across as patronizing. But if you understand the genetic factors, if you understand their capabilities, their boundaries, you're going to give much stronger advice. Age. Well, age is a natural process of the human body. And as far as I'm concerned, yes, age is a factor that we can't control, but age doesn't really mean anything. Not really. We should be assessing people on what we see. So we should be observing people rather than going, oh, you're this old, you should be doing this. You know, there's 80-year-olds doing skydives. You know, my mother-in-law, she's a great example of people in their 80s. She goes on holiday, she's active, she drives her car, she's fully independent and loves life. So we shouldn't be judging on age, but age is a fact that we can't control. Gender. So there are certain health conditions more common in gender, people more at risk. So if you look at fatalities, then obviously you'll get an idea of where they sit. I think men are more prevalent to things like cardiovascular diseases, and that's why they tend to die 10 years to the counterpart to the females. I'm sure that study's changed slightly, so I may not be fact checker about that, so don't quote me, but as a working example. Environmental factors. So environmental factors might be your pollution, your climate, your demographics, where you live. It could be cars, it could be pollen, whatever is there. And again, they can't be controlled. However, there may be ways in which we can limit it. There may be ways in which we can look at a long-term plan to help reduce it. So if you've got somebody whose quality of life is poor in a location, have they thought about moving to an area of the country where there's less pollution and less pollen, which normally results in seasides? So I have quite severe asthma at times. I can have an asthma attack just like it comes out of the blue, no reason. Normally triggered by pollen, dirt, car fumes, or pet fur. So in the end, I end up moving to the coastline because there's less pollen, there's always a breeze down here, and I could just breathe better. You know, so sometimes when we think about problem solving, that's where we need to be. Is it reasonable to suggest that we can improve air quality? Probably not, even with the ridiculous ULEZ policies coming in across London. You know, because if you work in London, the underground is, I think it was something like 100 or 200 times more polluted than above air. So ultimately, it is about those choices in which we have to make as well. But problem solving that with somebody is great. Social economic factors. So that could be around their community infrastructure, where they're living. Do they have access to more facilities and services than others? So that could be a factor. Access to healthcare. So again, I was talking to a couple of healthcare providers only the other day. So across Sussex, we have multiple trusts, and those trusts are run by community matrons, and it's a big area. And then down in Somerset, they've got one trust. So thinking about access to facilities, but our counterpart in London has a hospital for each problem. Doesn't mean that then, you know, they're obviously as busy, if not more busier, but where you live does seem to play a postcode lottery. So just being mindful of that. So family history. So your family genetics, your inheritance, your learned behaviours, your nature nurture. It's a bit late, really. Once we've gone through that nature nurture and those behaviours are set within us, they're very much kind of there. That's not to say, though, you can't influence your behaviours or your values or your belief system. It just takes a very long time. And a typical example of that might be somebody who was raised by their parents, and their parents were quite flighty, quite quick to anger. What tends to happen is the next generation down have learned those coping skills and have observed that as a first-line response, and therefore they become quick to anger. But ultimately, that's a behaviour, and that can be rectified through CBT. And this is really why, when we look at how we raise children in that nature-nurture argument, if we shout at them, if we smack them, if we shame them, that's what we're teaching them. We're teaching them to do that to their children, because that becomes a learned behavior. And we know that through experiments like the Boo Boo doll, where they had that blow-up doll in 2 rooms, and one room the teacher went in and hugged the doll, and in the other room the teacher had a hammer and she was hitting it. All of the children in the room with the hammer went up and hit the doll, and all the children in the room that cuddled the doll went and cuddled the doll. So that learned behaviour, that nature-nurture debate is really important there. But there are some family histories which are really important for us to know. So things around cardiovascular disease and cancers, etc., Alzheimer's, things like that. And again, chronic diseases. So we've got our factors that can be influenced, our factors that can't be influenced. They just help us draw together that bigger picture. So moving on then, help people, groups and communities to identify the barriers and address those overcomes to achieve better health outcomes and well-being. That's my little one again. Number one, we're going to identify the identification of barriers. So what we need to do is, first of all, work out what the barrier is. So here you can see we've got an example with personal hygiene. So unhealthy diet, lack of exercise, smoking. So those personal habits there. We then look at those psychological factors, which is probably stress and mental health and health conditions. And then there's those financial constraints, which look at limited resources around health and living. So once we identify the individual barriers, we can then look at the group barriers. So are there shared challenges, cultural, and then we've got community barriers, which looks at access. Let's go back. Bear with me. Yeah, so then we've got shared barriers, shared responses, community barriers is looking at access to healthcare, environmental and social economic. So again, looking at availability, affordability, pollution, green space, poverty, unemployment. Once we've identified the barriers, we can look at the strategies. Go back to my toolkit, we've done strategies, we've started strategies. And here we can start looking at, well, what are those strategies? So that's going to be education awareness, behavioural support, financial aid and guidance. So that's going to be the charities around like Turn to Us or Turn to You, Citizens Advice Bureau, Shelter, any of those charities that can help work out where we're at. Then we're going to go to a collaborative approach. So we're going to look at then working across groups and communities for better outcomes. And then we can monitor and evaluate. We can keep in touch, follow, do regular checkups to see how people are progressing. And I know this works because I have done it 100 times in primary healthcare. I've had people come into me crying, suicidal, I can't cope. We talk about it, we get down to it. It's a clear social problem. We look at what the problem is. We look at then getting the right help, the right charities, the right support. I see them in 4 weeks' time and they're like, Steve, the weight's been lifted from my chest. I can breathe again. I understand what I need to do. We do that by assessing the individual. So we assess the needs. We recognise what's important to them. We look at what they can do. And then we look at those strategies to assist them. So is that around education, personal support, community building, relationships, healthy choices, advocacy, or follow-up? So again, we can tailor our approaches to problem solve, solution solve with this individual. S4 looks at working with people in communities to identify and access to local resources and assets and wellbeing. So here, we as continuing healthcare practitioners need to engage more in our community. We need to understand more what's going on, because if we can refer people, the better the outcomes. And there are so many charities and groups and organisations doing little bits. And it might just be that little charity that just ticks that person over. We're going to identify local resources and assets. So what's there already? What things are going on in the hospital? What things are going on in the doctor's surgeries or the dentist? What's going on in parks? What's going on in churches? What's going on in schools? Build yourself a portfolio of things that you can signpost people to, that real social prescribing aspect. Create the access. So think about social access. So how can people get there? Maps, resources, transportation, and then again, affordability. So my best thing, or my favorite thing, is free. If you can put free into the system, free community groups in the local area, hopefully you'll find things that you can refer people on to. Building those partnerships, so the more you build, then the more innovation, the more people understand the needs of the sector, the more that you'll be able to talk to organisations about maybe things they could do to help you. Enriching skills and empowering people. You too, as a community health and wellbeing practitioner, you could do some teaching and workshops. You could start a YouTube channel like I did. You could talk about those public health strategies, eating 5 a day, or ways of cost-effective budgeting. There was a great I say a great program, it's not really a great program, but it's a really good program. I quite enjoy it. And that program is about Benefits Britain. And the way these people spend their money is phenomenal. Like the outcomes that they achieve on such little budgets, you would never think of the strategies that they do. And yet they can live well. Their houses are well maintained. They look well maintained. They're eating well, because they've learned the skill of budgeting and spending and shopping and being thrifty, for a better word. But again, that's a life skill for everyone. Life skill for everyone. To learning and development, again, around health promotions, so that might be, look, go to your pharmacy, get your blood pressure checked, go to your pharmacy, know your glucose. Fine. Again, we don't need to be going to the doctors. The pharmacy can do stuff. Look at that ongoing support and then evaluate it and see how that impacts. So there is so much more we can be doing for the people in which we are looking after. So much more we can be doing. Just because somebody's in a residential home does not mean that they can't access all of this. Doesn't mean it at all. Who's in your local group? Who can come and take people out? Who could come in and do things within your home? Activities. What things could people be doing? Health promotion. Let's do some brushing teeth exercises. Let's do face washing. Let's do hand hygiene. Whatever it is, it's about using innovation and different techniques. So here you've got some references. Looking then at those references, you've got community access to public health, social determinants for health, health behaviours, asset-based community development, and cultural sensitivity and global health. So have a look at some of those articles. They're really good reads. We then have our professional practice. So in our professional practice, we look at things around British values, prevent health and wellbeing, equality and diversity, health and safety, information, advice and guidance, safeguarding and functional skills. Right, so here is your first assignment. So it's a bit of a role play thing. In the context of promoting health and wellbeing, or various play a crucial role in some of the individuals some of which individuals may or may not have control over, drawing on a multidisciplinary approach to discuss the following aspects. So 1, analyse how professionals can assist others to recognise complex factors, including personal health and wellbeing, distinguish those between there and control the influences that can and cannot be. So go back to that first slide. Explore the strategies and interventions, examine the various barriers, and discuss the importance of working collaboratively. Your answers should demonstrate a comprehensive understanding of the selection between them. So we want you to just think about, you've got somebody there, how can you work in a multidisciplinary way, analyse that, explore those strategies, so looking at what I've already given you, those tools, referral points there, and then obviously discuss that importance. And what I really want to say here is, when we look at this is our foundation block of learning. So duty 1 is going to give you the toolkit for moving forward. So when we look at behavioural science, when we look at the acceptance and commitment therapy, cognitive behaviour therapy, when we look at solution-focused therapy, when we look at the therapy approaches that we're going to look at moving forward, we need this behind us, because when we come up with a care plan, we're going to want to give interventions that are helpful and meaningful to the individual. So it's really important you grasp duty one. If you've got any questions, pop them in the chat. I'm more than happy to answer them. But until then, good luck on duty one essay, and I will see you all next week when we look at duty two knowledge.